What is up, YouTube? Welcome back to another YouTube video. And man, today I am outside the doctor's office waiting to see if I need to have an appointment later on for treatments or a surgery. I'm not so sure, but right now they're pretty much closed. I know I'm here early, so I'm here right now in my car just waiting because I think they're in their lunch break. But just to let you know, my wife is at the veterinary office. I think that's how you say it. Just for our puppy Apollo G. Seeing his first doctor's visits for his first shots. I don't know, man. I never had a dog before that I had to go through all this with the shots and all that stuff. I don't know all about that stuff, man. And plus, I don't last long with dogs. I'm just saying. But hopefully, this dog lasts longer than the usual. But yeah, right now I'm outside the doctor's office waiting to see what I need to do and see that everything goes well. And for those that don't know what it is or what I had 5 years ago or 6 years ago, I had a pilonidal cyst and I had it surgically removed, and it didn't go so well, let's just say, and the recovery didn't go so well either. So right now I'm getting it all fixed, and I wanted to get it fixed before my baby gets born in May. And want to get this fixed before my wife gets pregnant. She's already pregnant before the baby is born. And I gotta get this fixed because, man, it's gonna be a struggle if I have the surgery and then she's all over here like giving birth and we're both like in the freaking bed and just but yeah, hopefully it goes well, and I'll probably record what's inside, not record it like video record, but probably like voice record and see what the doctor tells me. But yeah, we'll see what happens, and hopefully it goes well.
Viewer discretion is advised.
Hello, sir.
Hey, sir. I'm Dr. Pearl.
Good. Angel. Yes, sir.
All right. So you've got a cyst on your tailbone? Something like that?
Yeah, so I had a cyst and then I had it surgically removed 5 years ago.
Okay.
And then it reopened.
Okay.
And so that's the problem. And then it got worse.
Okay.
As in, like, I see, like, blood in the stool. And yeah, it's pretty bad.
Okay. What did they do for it the first time? Did they, was it something they did in the office, or did they do it like in an operating room?
Operating room,
okay.
Yeah.
Did they leave it open afterwards, or did they close it?
So they left, I think, from what I've known, I think they left it open and then for it to self-heal.
Okay.
And then, and then it closed, and then as of now, it reopened.
Okay. Do you remember, did you have to pack gauze in it?
Yes,
before?
so I had to put gauze, and then I had to put the honey medication.
Okay.
And I had to put it every day, gauze every day.
Okay.
Yeah.
And you said that was 5 years ago they said it?
5 years ago.
What kind of work do you do? Are you in school, or?
So I do CT scans.
Oh, okay.
So I do CAT scans. I'm MD Anderson.
Oh, nice. So, do you go to school to be a radiology tech first and then do CT scans specifically?
Yes.
Okay. Is it uncomfortable when you're sitting?
Oh man, like when I use the restroom, it's gotten worse to the point where it's like, when you take the poop out or whatever, it's just, man, then you can feel like the itchiness start to get like way more itchier.
Yeah.
And that's when I think that's when blood comes out or whatever.
Okay. I'm just gonna lean over the bed here. I'm just gonna take a look on the outside first. I'm not putting my finger in there or anything. I just want to be able to see it. So sometimes it can be hard to tell what causes it. There's kind of two different things that you can get. So like if your anus is here, like where the poop comes out, and then you have your butt cheeks like this. A pilonidal cyst is always going to be a little bit higher. There's not really like a demarcation line where it's like above it, it's one versus the other, but the pilonidal cyst tends to like start in this area and then go north. What you have is right down here, right on the anus. That I don't think it's a pilonidal, which I guess you could say is good or bad. It could be good in the fact that you don't have a recurrent pilonidal cyst, but what you looks like you have is more of a fistula, which is an infection and inflammation right at the edge of the anus, which is why it hurts when you have a bowel movement, because it's going right past there and it's all inflamed and obviously causes irritation and then bleeding afterwards. The only reason that distinction is important is I take care of tons and tons of these. I would send you to a colon rectal specialist for this kind of thing, only because, especially if you've had anything in this area before, if it recurs at all, it just gets more and more complicated every time. So you really want to make sure you get to someone who does this kind of thing all the time to take care of it.
Okay.
So what happens with these is there are little oil and like mucus producing glands all around the anus like this, and they can get infected and irritated, and then they do exactly like they itch, and then they bleed, and then they'll heal a little bit, then they itch, and they bleed, and then they heal over, and then that process keeps happening over and over again. So it's hard to know if this is maybe what you had before and they treated it, or maybe it really was a pilonidal, and then now this is something separate. That's possible too, but what you have back there definitely doesn't look like a pilonidal.
Okay.
So the good news is too, like, you're young and healthy. These kind of things, when properly treated, tend to go away, and you have pretty good success with them. But I send all these to colorectal specialists because it's so close to your anus. Sometimes they have to do surgery in there, and again, you want to make sure you get someone that does that kind of thing all the time, does a good job with it.
Okay.
In the meantime, what kind of things have you done, or have you tried to make this better?
So I feel like I've tried mostly. Did the same thing as when I had the pilonidal, was the honey, just with a swab and just go in there.
Yeah. That's probably pretty uncomfortable, huh?
Yeah, and so I feel like, and then I used to use the it's like the clear cream, antibacterial.
Okay.
But I've seen that not to work, or even the honey. I think it's gotten worse.
Yeah.
Once I keep tempering it.
Right.
But yeah. No.
Yeah, I think I would switch strategies on it a little bit. The most effective thing would be just trying really not poking at it or putting anything on it, but just trying to keep it real clean. So usually what we recommend for these is like what we call a sitz bath, where you sit in a hot tub or a warm water tub for like 5 or 10 minutes every day. That helps to clean the area, and also the warmth generates more blood flow in the area to help it heal. Practically speaking, most people can't like sit in a hot tub for 5 or 10 minutes every single day. I mean, you have work, it looks like you're married, you got a wife, maybe kids, all this, you got a lot of stuff going on. So as best you can, just keep the area clean. After a bowel movement, sometimes if you can, just like jump in the shower if you're at home. So you're showering at least once or twice a day, just let water run on the area. That's probably going to be more helpful for this kind of thing than putting anything on it necessarily.
Okay.
Thank you. And like I said, I would give you any treatment that I thought would help right now, like antibiotics and all this stuff. It's just going to be keeping it clean. I think it's going to be the best.
Okay.
Okay?
Yes, sir.
You can come out here when you're ready. Thanks.
So, quick update, guys. I know, whatever the doctor says, yeah, it's pretty much embarrassing. But I'm hoping tomorrow is different news with a different doctor. Let's see what that doctor says. And yeah, that's pretty much the update. Also, my little dog, I'm not sure if you can see him. I think he's right here. Where's he at? Over there? Yeah, he's super medicated right now. So yeah, he's going through the same issues as me. Nah, I'm kidding. But yeah, he's pretty sleepy, and yeah, he's in the healing process after all the shots. But yeah, that's pretty much it for me today. Like, subscribe, and hit the, actually, I'm over here messing up, but comment, and that's pretty much it. Peace out.